My name is Danae and I found out about PRMA when I was first diagnosed with breast cancer, and I wanted to make sure I had the best care possible for my reconstruction. So I actually visited support groups, and when we would go around the room and they'd ask me if I had any questions, I'd say, my question was I want to know who did your breast reconstruction and if you were happy with them. So when I was very early into treatment and chemo, I made an appointment that was all based on feedback from survivors that have been to PRMA and had their reconstruction with them. They raved about them, so I made my decision then and there. That's who I was going to come. Well, I originally decided on implant reconstruction because at the time I was an athlete, and when I was diagnosed I was training for a half marathon and I did triathlons, and I was very thin. I really didn't have very much abdominal tissue to use, so we were going to have to look at other options if we did DIEP flap, like partial implants. And I wanted to really, after going through 6 months of chemo and 6 weeks of radiation, I just really wanted to do something that was just faster and easier to recover from and get back to exercising and running. So I just decided to go with implants, knowing that something would probably have to be done later on down the line. 3.5 years later, I guess about a year ago, on the left side where there was radiation, just a lot of tightening up and a lot of scar tissue buildup, to where the year before I had found some lumps and they actually removed them to test them to make sure there wasn't anything going on, and it was scar tissue from the radiation in it, and the scar tissue had attached itself to my implant. So I gained weight over the 3 years, and I decided to come and talk to Dr. Ledoux again about it, and he looked at everything and he said, you're definitely a good candidate. When you're ready to do it, if you want to do it, we can do it. So I thought about it for several months and decided I wanted to do, I wanted the implants out. So we decided to go with DIEP flap, and I had that done. It hasn't quite been 4 weeks ago. It's been 3 weeks and 5 days, and I'm so happy I made that decision already. The shape is beautiful. They're full. They look just as good as the implants did, and they feel so much better. With the DIEP flap reconstruction, it is a longer recovery, but it hasn't been a terrible recovery. Just what they use now for their pain management works wonderfully. I never once had to take a narcotic pain pill, and the support that they have here with the staff and the nurses is incredible. I don't think you can get better assistance and support anywhere else. And I've spoken to many others that have had this procedure, and they all say they would never change the decision they made, and so far that's how I feel as well. It's definitely worth it. And any woman that has a question online on the different support groups that I am, right away I refer them to PRMA, and it doesn't matter where they live. They don't have to live in San Antonio. I recommend that they get to PRMA because the doctors are wonderful here. They're going to go over all the options with you. They're going to explain and look at what's best for you as an individual person, because everybody is different. Whatever you're thinking, I recommend that you speak to PRMA, and they will meet you where you're at and come up with the best plan that's for you.